Chronic pancreatitis causes and prevention. Chronic pancreatitis is a long-term progressive inflammatory disease of the pancreas that leads to permanent breakdown of the structure and function of the pancreas. The pancreas is a gland organ that is located in the abdomen, behind the stomach and below the rib cage. It specializes in producing important enzymes and hormones that help break down and digest foods. It also makes insulin to moderate the levels of sugar in the blood. The most common cause is long-term alcohol abuse. It is thought to account for between 70 to 80% of all cases. Chronic pancreatitis results in over 122,000 visits to a doctor and 56,000 hospitalizations annually in the United States. Significantly more men than women are affected. Causes. Chronic pancreatitis is usually a complication of recurrent episodes of acute pancreatitis. This can lead to permanent damage in the pancreas. Acute pancreatitis is caused when trypsin becomes activated within the pancreas. Trypsin is an enzyme that is produced in the pancreas and released into the intestines, where it breaks down proteins as part of the digestive system. Trypsin is inactive until it has reached the intestines. If trypsin becomes activated inside the pancreas, it will start to digest the pancreas itself, leading to irritation and inflammation of the pancreas. This becomes acute pancreatitis. Alcohol misuse. Alcohol can cause a process which triggers the activation of trypsin inside the pancreas, as can gallstones. People who misuse alcohol and develop acute pancreatitis tend to have repeated episodes and eventually develop chronic pancreatitis. The repeated bouts of acute pancreatitis eventually take their toll on the pancreas, causing permanent damage, which then becomes chronic pancreatitis. This is also known as alcoholic chronic pancreatitis. Idiopathic chronic pancreatitis. When a disease is idiopathic, it has no known cause or reason. Idiopathic chronic pancreatitis accounts for most of the remaining cases. Most cases of idiopathic chronic pancreatitis develop in people aged 10 to 20 years and those aged over 50 years. Nobody is certain why other age groups are really affected. The SPINK1 and the CFTR genes, types of mutated genes, exist in about 50% of patients with idiopathic chronic pancreatitis. These genetic mutations may undermine the functions of the pancreas. Other much rarer causes include autoimmune chronic pancreatitis, in which the person's own immune system attacks the pancreas. Hereditary pancreatitis, where patients have a genetic condition and are born with a faulty pancreas. Cystic fibrosis, another genetic condition that damages organs including the pancreas. Symptoms. Common signs and symptoms of chronic pancreatitis include severe upper abdominal pain that can sometimes travel along the back and is more intense following a meal. Nausea and vomiting, more commonly experienced during episodes of pain. As the disease progresses, the episodes of pain become more frequent and severe. Some patients eventually suffer constant abdominal pain. As chronic pancreatitis progresses and the ability of the pancreas to produce digestive juices deteriorates, the following symptoms may appear: smelly and greasy stools, bloating, abdominal cramps, flatulence. Eventually, the pancreas may not be able to produce insulin at all, leading to type 1 diabetes, which can produce the following symptoms: thirst, frequent urination, intense hunger, weight loss, tiredness, blurred vision. Complications. There are several ways in which chronic pancreatitis can develop and become more harmful to a person's well-being. Stress, anxiety, and depression. The disease may have an effect on the patient's psychological and emotional well-being. Constant or recurring pain, which is often severe, may cause distress, anxiety, irritability, stress, and depression. It is important for patients to tell their doctors if they are emotionally or psychologically affected. If there is a support group in your area, being able to talk to people who share the same condition may help you feel less isolated and more able to cope. Pseudocyst. This is a collection of tissue, fluid, debris, pancreatic enzymes, and blood in the abdomen, caused by leakage of digestive fluids escaping from a faulty pancreatic duct. Pseudocysts do not usually cause any health problems. However, sometimes they can become infected because blockage to part of the intestine or rupture and cause internal bleeding. If this happens, the cyst will have to be surgically drained. Pancreatic cancer. Even though pancreatic cancer is more common among patients with chronic pancreatitis, the risk is only 1 in 500. Diagnosis. There are no reliable tests to diagnose chronic pancreatitis. A doctor will suspect the disease because of the patient's symptoms, history of repeated acute pancreatitis flare-ups, or alcohol abuse. Blood test may be useful in checking the blood glucose levels, which may be elevated. Blood tests for elevated levels of amylase and lipase are not reliable at this stage. Amylase and lipase blood levels rise during the first couple of days of pancreatitis and then settle back to normal after 5 to 7 days. A patient with chronic pancreatitis would have had the disease for much longer. Doctors need to have a good look at the pancreas in order to diagnose the disease properly. This will most likely involve an ultrasound scan. High-frequency sound waves create an image on a monitor of the pancreas and its surroundings. A CT scan. X-rays are used to take many pictures of the same area from several angles, which are then placed together to produce a 3D image. The scan will reveal changes of chronic pancreatitis. Magnetic resonance cholangiopancreatography or MRCP scan. This scan shows the bile and pancreatic ducts more clearly than a CT scan. An endoscopic retrograde cholangiopancreatography or ERCP scan. An endoscope is instead inserted into the digestive system. The doctor uses ultrasound to guide the endoscope through. Patients with chronic pancreatitis have an elevated risk of developing pancreatic cancer. If symptoms worsen, especially the narrowing of the pancreatic duct, doctors may suspect cancer. If so, they will order a CT scan, MRI scan, or endoscopic study. Prevention. Patients with acute pancreatitis significantly reduce their risk of developing chronic pancreatitis if they give up drinking alcohol. This is especially the case of patients who drink heavily and regularly.